Hello, good evening. We have patients sitting in every nook and cranny of the department. The words of one A&E consultant who's told this programme about the challenges facing Wales' largest hospital. Patients at the University Hospital of Wales are facing extremely long waits, with staff admitting that care is being compromised as they deal with unprecedented demand. It's the reality being faced by hospitals right across the country. The Welsh Government says it's investing in transforming emergency departments and improving the flow through hospitals. Our health reporter Katja Empson was given special access to see some of the pressures and what's being done to combat them.
University Hospital of Wales Emergency Department. Stretched teams prioritise the sickest patients. Others face a long wait. Dr. Katja Empson's worked here for 14 years. This is the toughest she's ever seen it.
Things are certainly worse than I've known them, and there's lots of different reasons for that. Lots of complexity in terms of how and when people present to hospital, lots of challenges in terms of moving patients through the emergency unit and into the hospital. And care is compromised because there isn't the available space in the wards and the places to admit them into beds.
How busy can it actually get?
So our very busiest days will have about 550 patients have turned up in one 24-hour period.
It sounds like you're having to make really tough decisions on a daily basis.
Yeah, I think we do. We have to constantly balance the risk across the emergency unit, but also across the whole system.
Right now, there are 83 people in this emergency department. Some of them will come here for further treatment. They're only supposed to spend around 24 hours here. It's not suitable for longer stays, but other wards are full, so some of them are spending up to a week here. And the patients keep on coming. Beds are only empty long enough to be quickly cleaned for the next person. Today, there is some dignity here, but the same can't be said for everywhere else.
When every single kind of cubicle and nook and cranny of the department has got a patient sitting in it, your capacity to sort of manage all of those patients safely becomes challenging.
And the problems start even before patients get through the front door.
So this is where the ambulances arrive on the forecourt, and then the paramedics will have a conversation with the clinical team here in the hospital to hand over the patient.
Often there'll be very long waits before crews can do that, meaning other 999 calls go unanswered. So this hospital's thinking of new ways to tackle that.
So this clinical area is a space that we try to always have empty and available for use, and that's so that we can support the Welsh ambulance team to manage their risks in the community, because when they need to immediately have an ambulance available, we can bring a patient into this space and the ambulance can be immediately released.
So this is a new innovation that you've had to come up with to deal with greater pressures?
Yeah, absolutely. We don't put a patient in here for a long period of time. They're in and out of this space to help manage the flow into the hospital.
And it's working. According to figures from the Welsh Ambulance Service, in December, handover delays were reduced here by almost a third compared to this time last year. But it doesn't solve the problem of bed shortages. To do that, more drastic changes are needed. In another part of the hospital, an entirely new ward has opened. It's dedicated to patients who no longer need acute treatment, but still require extra support before they can go home. On average, there are around 350 patients who are medically fit for discharge in this hospital every week. By moving some of them here, other beds are freed up.
We've admitted approximately 112 patients into the unit since we opened in October, and we've managed to safely discharge 90 people. So we are managing that flow, albeit perhaps we've got huge demand to meet, but patients are moving through the system safely.
We've got a fantastic team of physiotherapists who would be supporting patients to get them up and walking again, and also just helping to improve patients' well-being and mental health whilst they're here.
Ultimately, it's all about getting patients in the best condition to go home.
Absolutely, yes. Often these patients are waiting for a package of care, and we know that there are sort of shortages in the community. So what we want to do is try and maintain and build on people's abilities and independence.
And they're ready to go home sooner. With this unit, the average length of stay for patients who are medically fit for discharge has been shortened by almost 2 weeks.
Why is it so important that patients don't stay in hospital for longer than necessary?
If people stay in hospital, we decondition them, so there isn't, in a hospital ward in a busy environment, we don't have the spaces for mobility, so they're muscle wastage, and it just leads to them not going home. Could you imagine coming into hospital and never being seen in your house again? The whole opportunity of this ward is to optimise them and hopefully get them to where they would like to be, which is predominantly home.
This unit was opened to help the hospital get through the toughest winter months. But many feel those pressures now exist all year round. And for all the innovation today, tomorrow will still bring hundreds more patients. Katja Empson, ITV News, Cardiff.